We've all heard stories about labor being exhausting and needing all kinds of medical assistance. Today, I'm here to give you some tips on how to make labor easier and dispel all the myths associated with the painful process of labor. Hello everyone, I'm Dr. Jnanashree, Consultant Obstetrician and Gynecologist at Cloudnine Hospital, Malleshwaram. When a woman feels confident in her body and mentally well supported by her family or spouse or partner, I think she's going to be able to handle the stress of labor far better. So I think I will discuss it point-wise. First of all, your lifestyle changes. A healthy diet and a healthy mind definitely helps you to sail through the process of labor. Now, this dietary advice doesn't have to start off from the day you got pregnant. It starts off preconceptionally as well. So sticking to a balanced diet of fresh fruits and vegetables, dry fruits, particularly walnuts and almonds, a high protein diet. So when we talk of high protein diet, for a vegetarian, it would be sprouts, dals, milk and milk products, paneer, soya. And for the non-vegetarians, egg whites. Stick to a lot of egg whites and chicken, fish. Fish is another good source of omega-3, which again is important for the baby's development as well. Now coming to the exercise or being about the physical activity. Keeping yourself physically active from the day you have conceived until the day you come in labor is very important to ensure a smooth process of labor. So again, in physical activity, unless your doctor has advised you not to do a certain kind of exercise or yoga, please restrict. Otherwise, start off with walking. If you haven't been doing anything, start off with walking. And as you cross your first trimester and after the anomaly scan is done, you can definitely start doing the antenatal exercises, that is a pelvic floor like Kegel, yoga and meditation, butterfly, squats, simple stretches. Here at Cloudnine, we have a very good program for the expectant mothers as far as antenatal exercises and yoga is concerned. We have a very good physiotherapist who is going to educate, and you can even have a one-to-one consultation with her and start off the antenatal exercises from the second trimester onwards. Third and most important is educate yourself about the process of labor by asking your doctor, and he or she is the best person to tell you the right things rather than listening to stories from family, friends, colleagues. So usually after 28 to 30 weeks of pregnancy, we start telling the patients how to monitor the kick count, what are the warning signs to look for, like if there is a bleeding per vaginum or the woman has leaking, or what is labor pain, how long do they last. So this education is definitely going to help in knowing as to what to expect with each passing day in pregnancy as well as when you come in labor. Also, there is something called as painless labor. There are various modes of painless labor, but the routinely used one and the most safest is epidural analgesia, which is definitely going to help you in having a vaginal delivery and also making the labor process much easier and smoother. So a lot of patients have many myths or misconceptions related to epidural analgesia, but it is being practiced all over the world as one of the safest methods. So what happens here in epidural is, once a woman comes in labor, she is in the latent phase of labor. Until about 3 centimeters dilatation, it is called as a latent phase. After 3 centimeters, that is 3 to 10, is the active phase of labor. That is when you are going to feel a lot of pain, contractions, and you start begging your doctor for a cesarean. And that is when epidural will come into the picture. So the duration of labor is about 14 to 16 hours. So the initial latent phase will be very mild contractions. The later half is going to be strong, wherein epidural is going to be administered and you're going to be very comfortable and deliver vaginally. Also, another important advice I would like to give all our patients is, when the labor pain starts or some contractions start, do not panic and rush to the hospital. Wait for an hour or two at home. Wait for the labor contractions to increase and to actually figure out whether it is false labor pain or true labor pain. And if it's not settling down in an hour or two, then you come to the hospital, because it really doesn't happen the way they show it in the movies, that pain starts and the next minute you deliver. It doesn't happen that way. Duration of labor is about 14 to 16 hours. So take your time and come to the hospital, which avoids unnecessary intervention even from the doctor's side. And now coming to the most important part, The partner or spouse plays a huge role in making the entire process of pregnancy and labor easy and manageable. So I would encourage the husbands to come with the mother to be, mom to be, for most of the antenatal visits. I would not say all the visits, but as far as possible, or probably when the ultrasound is due, so that he also gets to see the baby and what the mother is going through, and educate themselves again about the stages of labor. Simple gestures during labor, such as holding the hands of the mom to be, or encouraging her to push, will go a long way in boosting her confidence and ensuring a vaginal delivery. The debate about spontaneous onset of labor versus induction of labor. So there has been a lot of misconceptions about induction of labor. A lot of women ask us that induction of labor is far more painful than the spontaneous onset of labor. Although to a certain extent it is true, you need to understand that induction of labor is planned by a doctor only when there is a medical indication. Spontaneous onset of labor, yes, definitely most doctors will wait for the woman to come in labor on her own. But in case there is a medical indication like a pregnancy-induced hypertension or a gestational diabetes, or where the baby is not grown to the optimum weight, induction of labor is safe and is one of the accepted modes of delivery. So do not have any fears regarding induction of labor. To conclude, if you've been following a healthy diet and keeping yourself physically active throughout your pregnancy, and listening to your doctor, all the instructions given by your doctor, rather than Googling, I think much of the stress and anxiety associated with labor can be handled better.